This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
I guess I would like to see more people comfortable with thinking ahead about their own death. So if the more that we can help our society become less fearful and avoidant of the topic of death, I'd love to see more people have time to actually plan for the end of life and be less afraid, so that they could spend more time with their families and have hopefully more peace and more quality of life at the end of life.
This is the Heart of Hospice podcast with Helen Bauer. Dr. Karen Wyatt, host of the End of Life University podcast, is back on the show today. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice is here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
This episode of The Heart of Hospice is sponsored by Odonata Care. When caring for a loved one on hospice, support becomes essential. Introducing the Care Plan, a path to comfort for the hospice patient, a supportive guide by experienced hospice nurses Nancy Hireman and Brenda Kazire. Nancy and Brenda invite you to experience all that the Care Plan has to offer. Be sure to check out their free library of care videos on thecareplan.net or on YouTube. Purchase your copy of the Care Plan today at thecareplan.net.
I'm so honored to have Dr. Karen Wyatt back on the show. She is a retired hospice physician and the host of the End of Life University podcast. She's the author of the book 7 Lessons for Living from the Dying, which contains stories of patients she cared for in hospice and the spiritual lessons she learned from them at the end of their lives. She's widely regarded as a thought leader in the effort to transform the way we care for the dying in the U.S. She's a friend, a colleague, an industry expert, and just a compassionate voice for end-of-life care in the U.S. During our conversation, and this was definitely a conversation, it was so nice to connect, Karen shared what she's reading, what she's watching, and what she's been talking about and focusing on lately. Karen and I discussed the trends that are happening in hospice that are sort of weighing on our minds. She shared how providing medical care at home just blew her away, and that she believes that this is how medical care should be done. You know, in that more personal, intimate setting that shows us who our patients are as people. We also talked about the tendency we have to label people when they become patients. When they become ill, the first thing we assign them is a label that says patient, and then we assign them a number. It's dehumanizing. And we talked about that at length. Karen also added something to her memorial service plans as we were talking. You'll have to hear what she picked up on and added in. I asked Karen what lessons she thought we learned during the pandemic, and we talked about that quite a bit as well. So you're going to love this conversation that I had. Here's my talk with Dr. Karen Wyatt. Karen, it's so great to have you back on the show. Welcome.
Thank you so much, Helen. It's so nice to have a chance to talk with you again.
It's so good to connect with another end-of-life professional, but also another podcaster, because it always makes the interviewing and the conversation seem so much easier.
Yeah, it's true, because we're both comfortable behind the microphone, and that really helps a lot.
Absolutely. So I'm going to start out with a personal question, just an icebreaker question that I didn't send to you so we can just chat for a minute. We've already talked about grandbabies, which is wonderful. So what are you reading these days? You reading anything good?
Well, let's see. I'm trying to think of what I've read most recently because I haven't been keeping up very well with my reading, just because I have a new grandbaby on the way and I'm doubling up on all my work to try to get ready for the baby. So I'm trying to think of what I last read. Oh, I read a book for an interview I did on Lewy body dementia I honestly didn't know very much about that topic. So it was a memoir written by Mary Lou Falcone about taking care of her husband with Lewy body dementia.
Interesting. That is a challenging diagnosis. We had a guest on a while back, and her wife had Lewy body dementia, and the behaviors are pretty unpredictable, and it's unlike some of the other types of dementia.
Yeah. And we talked about how difficult it is to diagnose. So a lot of patients don't get the diagnosis until they're very far along with the symptoms because it mimics other diseases, but it comes and goes and fluctuates. So yeah, it was an interesting conversation and a very good book. So that's the latest thing I read. What about you? What are you reading?
Oh my gosh. I have this stack of books next to my bed that's all about end of life and grief and death and dying. And I thought, you know what? I need a break from that because it's the talk that I have all day long with work and all the social media interactions that I have and the articles that I read. It's all related to the death space. So I thought I'm going to try to get something different. And so I pulled some fiction books. And what I found is I'm very interested in World War II and the Holocaust, which is not like an uplifting, cheerful topic, but I do like historical fiction. So the last book I read was about a multi-generational family who had lost almost everybody in the concentration camps. I don't know that it was encouraging or uplifting, but just something a little bit different to get my head out of death and dying, at least as far as end of life work goes.
Yeah, exactly. I know I've been searching for some fiction, trying to find my, where is it that I want to go with fiction, to read that will be entertaining, but like you said, to draw me away a little bit from these topics that we talk about all the time. So if anybody out there has recommendations for good fiction, you'll have to let us know.
Oh, absolutely. So do you find yourself drawn to books that are related to your work most of the time?
Always. I always see titles and I think, oh gosh, I have to read that book. I have to read that book about grief. I want to read that person's memoir. I need to read that. I'm drawn to them, but at a certain point you do start feeling a little bit overwhelmed in the subject matter.
Yeah.
And I know like my husband and I watch movies and sometimes streaming series, and we get completely away from end of life issues there. And that's always a nice break.
Yeah, I do the same thing. I think I find myself a little bit one-dimensional with my reading. I have a tendency, if I've got a colleague with a new book or I'm going to have a guest on, I'll order that book or they'll send it to me. And eventually I just think, is this all I'm interested in? Is this all I can focus on? So if I'm going to stream something on Netflix, I'll watch Will and Grace or Friends or Gilmore Girls just to get some humor and some light topics infused into what I'm taking in. Because it does get overwhelming, even if you're not at the bedside.
Yeah, it really does. And I sometimes I feel bad for my husband because I think, oh my gosh, look at what I talk about all day long with him. Like I'm always telling him a story that I heard or something, but it's always related to end of life issues. And I think how patient he has to be to listen to that all day long.
Does he work in healthcare at all?
Yeah, he is also a physician. He's retired now too. So he just patiently listens to me.
So he doesn't ever say, I'm retired. I don't want to listen to you. I don't want to have anything to do with this anymore.
No, he listens and then he goes and watches a movie about something completely different and to get away from me and my conversations.
My poor husband, I think the worst thing is, like, if we go to a funeral and visitation or whatever, then I have a tendency, especially if there's travel time involved, to do some advanced care plan conversations in the car. And he's trapped. And I will tell him, did you see this? I don't think I want that for myself. Don't ever do this for me. I can't stand this style of music. Make sure I have this and this and this. And he's just stuck, but it's on my mind. And it seems like a teachable moment, at least to me. So I make him have those conversations with me. And bless his heart, he's a quiet guy. And he just takes it in. And then he says, and this is classic, I'm not going to remember any of this. Thank you very much. You need to write it down. Yeah. So
true. Maybe we should create a support group for our husbands, and they can compare notes and support each other.
Spouses of end-of-life workers.
Yeah.
Because we have to be seen as a little bit weird.
I think so.
Yeah.
I think so. Really, just our comfort level with everything to do with death and dying, and just the fact that that's where we tend to gravitate immediately in terms of topics to discuss.
Yeah. Yeah. I'm more than happy to talk about my husband's death. I tell him that all the time. I don't think he thinks that's funny, but yeah, this is just the normal conversation for us, right?
Yeah, definitely.
So we want to do today's episode, your interview with me, a little bit different. I wanted to come to the interview without any questions this time, because I know where you're working, you know where I'm working, and we just wanted to have a conversation about what's going on these days. So what trends are you seeing? What issues are on your mind with end-of-life care?
Well, a number of different things. In terms of hospice care, I have a lot of worries right now about hospice care because of stories I hear, at least in places where private equity firms have been buying up hospices and are changing how hospices function to maximize profits. Like those things really scare me. Though when I'm out and about in the community and I meet with people working in hospice, I don't really see that with my own eyes. I just hear stories about it. And that trend concerns me a lot. Though when I meet hospice nurses and home health aides, they're still giving the same amazing care. When I hear from them about patients, they're still doing the right things and caring for their patients. So maybe it's not as dire as I think, but that's one concern I've had.
Yeah, that's a legitimate concern that I share as well. I know there's been some statistics that have been put out, and I can't quote them, but the quality of care and the frequency of care that's given to a patient of a not-for-profit hospice versus a for-profit hospice. So just for listeners, most of the hospice agencies in the United States are for-profit, and many of them are owned by investment bankers, not necessarily physicians or business people that have experience in healthcare, but more people with money, companies with money. And that's very common in the hospice industry. And what people are finding now is that patients of not-for-profit agencies get more visits, more frequently. They are more satisfied with the care that they get. The quality of care is different. And I don't want to scare people away from for-profit agencies, because I think in a lot of areas of the United States, that's all you have access to. That's another issue in hospice, right? Is rural access to hospice is a huge challenge. And then when you couple that with the staffing problems that we have, people's choices are pretty limited.
Yeah, it's so true. It's so true. You may live in an urban area that's kind of glutted with for-profit hospices everywhere competing with each other. But if you're outside that area, anywhere rural, it's likely that you won't have choices. You're lucky to have a hospice at all.
Yeah, you sort of have to take what's out there. Yeah, that's true. And I don't I don't think it's healthy to create a mindset in people that only the not-for-profit hospice is worth anything, because I don't think that's true. I'm with you. If you talk to the people who are doing the grassroots work, the people who are at the bedside and out in the field, all that money stuff falls away.
Mm-hmm.
They're not in charge of those high-level decisions. They're only in charge of the quality of care that they're giving on a one-to-one basis. And I still have a lot of faith in that.
Same here, because the people who are giving hospice care, who've been attracted to work in hospice, they're working from their heart, and they're not about the money. They're there because it's a calling for them and they're committed to it. So I trust that they're giving the very best care they can in the circumstances they're in, but I still think that's good care. I think the patients are doing okay and getting enough care at this point. I just hate to see, like, my beloved hospice industry, I just hate to see it be tainted in a way, and to hearing distressing stories about things that have happened, that really hurts, because in the old days, you would hear pretty much all positive things about hospice and hospice care. So it's painful, but maybe this is just part of the growing phase that we're going through too in hospice, as we move forward and there are new technologies and new ideas. Maybe this is just a temporary transitional phase, and something great will come from this time.
Do you think maybe we're unlearning? Because sometimes it seems to me as if we're in a season of unlearning. We know what a medicalized death looks like in the hospital, with all these different tubes and gadgets and processes and treatments attached to our dying process and our dying bodies. Do you think maybe we're unlearning and figuring out that's not the best way to do things?
I love that. I love that concept of unlearning. We do kind of have to unwind and unravel what was created in the past that doesn't serve us anymore. And we already know it's not the way most people want to experience the end of life. We already know that. But because it's so ingrained in our system, we do kind of have to step backwards and take it apart a little bit before we can create something better.
Yeah. I think that's true. I think learning to remove things, because the way technology and healthcare has advanced, the way science has advanced over the last, 50 years, 75 years, all of that progression, all that progress was seen as something wonderful. And now we've sort of figured out, well, maybe we're more human and those needs need to be at the forefront of what we're doing instead of all the fixing and the unnatural stuff.
So true. And there has to be a way to make space for something new. So that means sometimes we do have to remove parts that weren't serving us well.
Yeah. And that's where the education comes in. Absolutely. Which is what probably 90% of the work end-of-life professionals do, no matter what their position is, no matter what their role is in end-of-life care. 90% of the work that we do is education.
And there's still such a huge need for it everywhere, not only educating the general public, but educating medical colleagues who still don't know enough about end of life or how to support their patients, or even referring patients in for end of life care.
I was doing a talk earlier this week and was talking about my first death in hospice, the first death that I ever saw. And I had a really remarkable experience, which I think it was unusual. I didn't come to hospice thinking, oh, I'm called to do this. I didn't have that quite of a high mindset. I was more about, here's the nursing job. Nursing is nursing. I need a full-time job, and this seems like a good fit. But my first day in the field, it was the third day at my first hospice job, gone through all the orientation stuff, learned the policies, watched the films, all that sort of stuff. And then my first ride-along visit with another nurse, the patient died while I was there. And
wow.
We were probably there 2.5 hours because the patient was actively dying, and the family had reported that she was, quote, having a bad day. Well, she was an end-stage Alzheimer's patient, bedbound, nonverbal, and all of that. So when we got there, the LVN realized that the patient was actively dying, and she just proceeded to make this incredible, supportive visit and experience. And I was just blown away by that. And then I realized I had worked as a nurse for 15 years before I ever saw someone die in their own home. And it's very, very different from what you see in the hospital.
Wow. What a powerful initiation into your new job, day 3.
It was amazing. And it taught me so many different things. For one thing, the professional arrogance, RN versus LVN, because we do have a tendency to relegate our LVNs to lower tasks and, consider them not to be real nurses, which is a mistake. But to be training with an LVN who had years of hospice experience, it wiped out every professional any thought of professional arrogance that I ever had. I was so grateful to be mentored by this woman, and then to watch this woman die. And she had a family member there with her, a woman who got into bed with her. Mm. And I've told this story so many times because it's very vivid for me. The family member told us that when the patient was still healthy enough to communicate, that she told the family she was only afraid of one thing when it came to her death, and that was dying alone. Mm. So when all this was happening and she was actively dying, the family member got into bed with her and wrapped herself around her like you would spoon someone and cuddle with someone. And she whispered in her ear the entire time she lay there dying until she took her last breath. And I had never seen anything like that.
Oh my gosh. So powerful.
Yeah, it was incredibly powerful. And not all deaths are like that. I get that. But to see that, and then the nursing director came and trained me on what the RN's role would be at a home for Texas, whatever our laws and procedures are. And then when we got done and everybody was leaving, she told me to go home for the rest of the day. And that was my very first lesson in self-care. She told me, she said, you take care of the patients and then you take care of yourself. And that's what I want you to do for the rest of the day.
Wow. She recognized the impact that would have on you.
Exactly. So I was fortunate enough to be immersed inside this team. I had a fantastic social worker, a chaplain that was just amazingly supportive. And my spiritual life grew because I knew these chaplains that worked on the team. It was just a blessing of an experience. And I realize not everybody has that, right? Some people it's just different. But for me to have stumbled into that, it was really just an incredible thing.
It's amazing. And I remember how blown away I was by the power of making a home visit to a patient. That made a huge impression on me. And I started thinking we should be practicing all medicine this way, because when you step in someone's home, you instantly know so much about them being in the home, and you're instantly connected to them at a completely different level. It's no longer just academic in your head doing a review of systems. You're there, you see where they live and what they cherish, and you just know so much more about them than you ever could find out in a clinical setting.
The Care Plan by Odonata Care has revolutionized the hospice experience by improving the standard of care. This booklet provides education and support to the patient and the patient's caregiver. The Care Plan provides step-by-step directions for caregiving tasks like cleaning or turning a patient. Hospice agencies utilize the Care Plan to support caregivers and to provide critical information in the moment when it's needed. This helps reduce after-hours calls and gives hospice staff more time for patient care. The Care Plan's simple design empowers caregivers by giving them the tools they need to feel confident caring for their loved one. Odonata founders Nancy Hireman and Brenda Kazire also offer a free library of care videos to provide even more support for caregivers. Videos can be found on thecareplan.net or on YouTube. The Care Plan is available in English or Spanish and can be purchased on the Odonata website at thecareplan.net. It's available in paper and digital formats, and bulk purchases are also available for agencies. Purchase your copy of the Care Plan today at thecareplan.net.
I was thinking about this the other day about when we admit a person to a hospital, or really when they get any sort of engagement inside the healthcare system, what is the first thing we do? What is the first thing we give them? A medical record number. They're assigned a number. So that immediately takes away a piece of their identity because they're not identified by a name anymore. And I think that there's a lot of identity that is lost when someone dies in the hospital. Again, it's not always a bad choice, right? Everybody gets to choose what's a safe space for them to die. But when we get to step into someone's home, we're surrounded by their entire life and their identity. And to me, it's very humbling to step into that.
Oh, yes. Yeah, exactly. I was it was a Q&A session with the hospice staff recently, and there was a non-medical person on the staff there who expressed that she was kind of dismayed, even in hospice, about all of the jargon that we use. Oh, yeah. And she said, why do you call everyone a patient? And you just corrected that, to refer to a person. She said, everyone's a patient, and you use all these acronyms all the time for things. And the nurses said, well, it's just a shorthand to make our note taking easier. But I think, it's true. We have to be careful of how we distance ourselves in a way from a person's humanity by the words we use and the way we write and talk about them.
Ooh, I'm glad you brought that up, because that's one of the things I wanted to talk about today is about labeling and how we use it basically to de-identify people. We talk about de-identifying medical records, and what that means is you take away any sort of demographic or personal information where you just get the medical reporting of things. It's generic and anonymous. But the way we label people and assign numbers and diagnoses, I wonder why we do that, other than the shorthand and the convenience of things. I wonder why we actually feel that it's easier to manage people's care if we do that to them.
To me, it seems like it comes from, in a way, our scientific mindset, that the way we've organized medicine is by groups of diagnoses and illnesses. And so we try to figure out what the diagnosis is first, because that lets us know what group do we put this person in, and then we'll know how to treat them based on that group. But it is so dehumanizing and so limiting, because the diagnosis a person has is actually really a small part of who they are. But when we over-focus on that and assume we know things about that person because we know their diagnosis, I think that's a big problem.
I agree. And I think sometimes I look at how we handle this system that we've created, this healthcare industry, which when you talk about industry, that's something that they produce things. They don't take care of people. To me, it seems at odds. It's quality and quantity. It's compliance and compassion. They don't mix well. They seem to be at odds with each other. So when we talk about a healthcare continuum, I think sometimes what that translates into in reality is a conveyor belt. So we take a person, an individual with a name, say the name John, and we say, okay, you're a patient, but we have 8 million patients. So we put you on the conveyor belt, and it's a system, it's an industry. It's not care. It's dehumanizing. But I often wonder if we do that, some of the labeling and the objectifying that we do, because it makes it easier for us to deal and cope with the fact that we are providing care for other human beings.
I think it makes sense that because hospice is still, it's part of the medical system and it follows the medical model.
Yes.
But also some of that distancing from patients may be self-protective in a way, because we're dealing with human beings, all of whom are going to die. And so we're going to have to say goodbye to them. We're going to have to walk them through their final days. And if we resort to some of that distancing just to protect ourselves emotionally, I don't know what you think about that.
I think that's absolutely true. I think that's absolutely true. And there's some intelligence to that. It's a coping mechanism on our part, because how could anyone do this work day after day after day? And I've known healthcare professionals that have been in hospice 30 years. That's a lot of wear and tear on your coping mechanisms and your emotional health and your spiritual health, adding compassion fatigue and secondary traumatic syndrome and moral fatigue and all the different things that we deal with. Maybe that's the only way we can do this and still stay intact as ourselves.
Yeah, I was wondering, have you done things within hospice, like having memorial services for patients? I mean, holding your own, some sort of ritual or ceremony with it for the hospice staff, just to help with the grief that people are experiencing?
I have never seen an agency that did, and I've never worked with an agency that did a memorial service that was strictly for the staff. But I have seen these rituals in the IDT meetings that we have every couple of weeks, where they read out the names of patients that have died since the last meeting, and they would either light a candle or take a moment just to pause and acknowledge this loss, this space that's been created by the death of a patient. And it's a time to acknowledge the team's loss, because it is a loss for the team. It's not simply a loss for someone else. And maybe that's the key right there, is to remember that it is also our loss to a certain extent.
Yeah, I think we need to acknowledge that. And somehow in medicine, like, there's this unspoken directive that you're not supposed to get emotionally involved with patients. Therefore, you shouldn't feel a loss when someone dies. But how unhuman is that? Like,
Yeah.
of course we feel a connection with everyone emotionally.
Yeah. We grieve with our patients and their families.
Yeah, of course we do.
And the ability to do that is what makes us good at what we do.
Yeah. I just remembered I was visiting Crestone, Colorado, where there's an open air crematorium. They actually have a pyre, and they can do cremations outside in nature.
Oh, wow.
And so I was visiting there, and it happened that all the death care workers in the area were having a memorial at that site, at the crematorium site. And they built a fire, and they all brought things. They wrote things on paper that reminded them of patients they had cared for in the last year. And each person read something special from their paper and put it in the fire. And it was like, wow, it was so powerful and so beautiful, because it was this way of saying, this is what I've been carrying. This person died 6 months ago, but I've been carrying this memory of this person with me. And it was, a way to finally honor that and honor their grief, and then put the paper in the fire so that it could kind of return to the elements. Anyway, that was a really cool ceremony to watch.
Yeah, that's beautiful. So I don't believe in the concept of closure, as in it's done and it's finished somehow. That word doesn't ever seem to settle. I think more of completion. Completion to me says it's come full circle, and you've held it, you've experienced it, and then you set it aside. It's somehow still there through memory, muscle memory and emotional memory. But to create a ritual like that, I love that. It reminds me of not the floating lanterns, wish lanterns.
Oh yeah.
If you've ever done one of those, I did one for a friend of mine that died. I just did it personally, by myself. It wasn't part of a ceremony or anything. It was just a personal ritual. And it had a great deal of meaning for me.
Is it one that floats up into the air like a...
Yeah. It's composed of paper and a lightweight wooden framing. And then it has a little cell on the bottom of it that you light. And as the heat of the little cell lifts up, it raises the lantern. And so it rises into the air. It's a beautiful thing.
I love that. Now I'm going to put that down because I want that to be part of my funeral. I just decided. I love that idea.
Oh, it's really pretty. My sister found these wish lanterns several years ago, and I don't know what gave her the idea, but for New Year's, she decided that we should all do wish lanterns together. And we did. Each of us had a wish lantern, and we went out after dark, really close. It may have been New Year's Eve. And we each released a wish lantern. So here was this group of our wishes and our dreams that we had attached to these wish lanterns, and all of them rising up into the nighttime sky.
Oh, wow.
It was very moving.
Incredible.
Very moving.
Okay, I have to do that. No, I love it. I love it. And to do it with your whole family, that's really beautiful.
And a fairly simple ritual. I like the idea of the floating lanterns too, which I think is a Japanese ritual from Japanese culture. And just the thought of that floating, being borne away somehow. Mm-hmm. Very similar to what you were talking about, where the hospice folks were writing a memory of a patient and then burning it, allowing the smoke to rise up.
Yeah, that's really beautiful.
Yeah, very symbolic. Oof, I like rituals.
I do too.
I never realized, I think until the pandemic took all of that away from us, I don't think I realized how important they were.
Yeah. Yeah, when you think back of what's happened over the last few years, and maybe as much as any new technologies we have, the pandemic has kind of shaped where we are right now also in a powerful way. We're trying to figure out, what do we hold on to? What do we go back to? What's most important to us in giving care to people?
What do you think were the lessons of the pandemic for end-of-life caregivers?
I think, for one thing, the pandemic brought grief out of the closet a little bit, because I've never seen so many people in the general public and the media talking about grief ever before. I think it was phenomenal that people suddenly woke up to the fact that everyone around you is grieving. Like, you have to assume that anyone and everyone is carrying some sort of grief with them. And I think it's the first time, at least in my lifetime, that has been so visible. And so I think that was one of the really powerful lessons. I think we learned just how important being able to be together at the end of life is, and being able to be with our loved ones, and what a tremendous loss that was when it wasn't possible.
I agree. I think the pandemic taught us lessons about who we are as grievers, and that there are things that we grieved that we didn't know we could lose, a sense of safety, a sense of security, the importance of togetherness and the impacts of isolation, and not just on people who were considered patients or their caregivers, but on the people providing the care. Such an impact on us. We realized that we could be what I call professional grievers. And there was a global conversation about it. I love that I think we talked more about grief on the podcast that last year of the pandemic than we were talking about death and dying.
Yeah. And I love the idea that we became aware of communal grieving, because, there were a lot of us who didn't suffer a personal loss. Like, no one that I know and loved died from COVID during the pandemic. And yet I've never felt so much grief, collectively, for all the suffering that was happening all around the world and all the stories that I was hearing. And I felt like it had the potential to bring all of us closer together. I'm not sure that was the outcome. I mean, some of us.
Did that actually happen?
Seems it hasn't hasn't panned out that way. But there was a time when there was just this amazing recognition of kind of globally of what other people were experiencing.
I think maybe we learned the value of the people that work in healthcare. I think we learned that our system was very fragile. We sort of, this is a terrible hospice pun, but I think we figured out where all the skeletons were, where the weak points were. And I would hope that we have learned something about who we are as healthcare providers, that, self-care, the way we used to think about it, the manicure, pedicure, vacation thing, that's gone. It's not about thriving anymore. It's about surviving as a professional caregiver.
Yeah, that's so true. So true. Everyone got pushed right up to the edge, right up to their limits.
I had a weird response during the pandemic because I wasn't working at the bedside, and I had actually just started working as an independent consultant. And so I became very disconnected. And I began seeing all these posts from people I was connected with that were still working in the hospitals and in the field, out in the community, and hearing these terrible stories. Some of them of personal loss, because these healthcare professionals were still having their own personal losses in the middle of caring for all these other people. But hearing the stories about the verbal abuse that they were dealing with and the overwhelm and the not knowing what to do because the rules changed from day to day as they tried to adjust to what was happening. And I remember feeling, first of all, guilty because I was not helping anybody do anything. I felt terrible. I felt like I was very protected and sheltered. And I felt guilty that I had these friends and colleagues going through terrible things. And I think it caused some depression on my part. And I felt like I was on the outside of things.
I had that same feeling. And here I'm sitting at home all by myself, safely recording podcasts, right. But then, a few people said, thank God we have podcasts to listen to. That's really helping us because we're isolated and alone. And I started doing extra episodes and creating more content, thinking, okay, well, maybe that is something to do. But my medical heart said I should be out there in the field helping as well. And I'm not contributing in that way.
Yeah. What do you think about the technology stuff? We expanded our use of technology and remote connections with our patients and families. What do you think about the use of technology when it comes to end-of-life care?
I'm actually feeling excited about it and optimistic because one of the other big problems we're looking at is just the shortage of providers. And it seems to me if we utilize technology in the right way, it can help us deal with the shortages in certain areas and thinking about rural areas as well as having a way to at least have a face-to-face encounter. And I think, pretty much everyone got comfortable using Zoom during the pandemic. And so
we did.
I found you can still have some really good interactions with people over Zoom. And I think it's something new that we're learning to be good at and skilled at. But I think it will help make up the deficit in providers that we have. It doesn't really help for bedside care and nursing, but
right.
At least for outpatient care, I think it will be helpful.
Yeah, I think there's definitely a place for it. I firmly believe that technology should never take the place of touch. And in end-of-life care, that personal presence, personal touch matters so much. But I think we can leverage the technology to where it's useful, to shorten the distance between us. And rural hospice is a big thing. I don't talk about that much on my podcast. I don't know about you, but rural hospice care is a huge challenge in a lot of areas across the United States, so much so that legislation has been put into place, I think it's the Rural Hospice Act, because access is so poor in rural areas. But, Yeah, I think we've gotten better at leveraging technology, and I hope that families have done the same. Because if you are in the home with, say, your mom, and you've got brother and sister that live, 600 miles away, you can have a Zoom call when the nurse is there so that everybody's getting the same information. You can have a family conference with the social worker from your hospice team over Zoom. You don't have to have everybody in the same room. So I hope that we have gotten better about leveraging the technology we do have.
Yeah, I think we have to use it as a tool and an asset. We can use it for good, and we don't have to despair too much about what if, about the negative aspects of it, but plan ahead and be creative about how might we use it to help us and to improve the care that we're giving, and instead of having it interfere with care.
Yeah. I think if we think of it as something that adds value in and enhances things instead of something that takes away from our connection to our patients and our families. Yeah. And a lot of it is free. So it's cost effective.
Yeah, that's true. Well, how about the idea of having like Chat GPT help with writing notes, clinical notes and documentation? Like, I think if it could do anything to make clinicians work easier, like be more efficient at creating the note, or I don't know, I could see some benefit there.
I don't know. That's pushing me. So I don't know. I begin to struggle with that immediately because the first part of AI is artificial.
That's true.
And I don't like that. I'm more of a natural person when it comes to end of life care. I'm the person that would say, take the wound vac off. Get it out of the way, move the tubing, use fabrics instead of plastic chucks, take the rails off, make room for presence, leave space for intimate contact. I just can't get past the artificial piece of things. Mm-hmm. And I don't guess I trust it quite enough for documentation. Documentation with nurses, documentation is the bane of our existence. What do you think about it?
Yeah, well, it's true. It's probably not refined enough and at a place where it is trustworthy actually to use fully in a situation. I was just trying to think if you had an AI scribe that you could dictate to who would just write all your notes, dictate while you're in the car and your notes would be done when you got home. I don't know. I was trying to think, is there a way to shorten the burden of documentation somehow? But I'm not clever enough to think of how it would work myself.
I like the sound of it, but I know nurses that use the talk to text aspects on their phones. And what I have found in auditing as a consultant is that they don't proofread it. Mm. And so here I am as an auditor, I'm going through and reading it and I'm like, I don't know what in the heck you were trying to say, but this makes no sense. And it wouldn't make sense to anybody. So I know that the nurse did not proofread it.
Yeah.
I think it's easy to become reliant on apps and software and things like that so that we sort of let go of some of our responsibility and our own accountability for making sure that it's accurate.
Yeah, that's true.
I think that would be easy to do.
One positive use of technology that I've been reading about is, say for an entire clinic full of patients, setting up an AI that has an algorithm that will trigger to doctors a notification like this patient needs an end of life discussion because of these various factors that are happening and these changes. It's time to think about having a discussion. And so I've read that it is making a difference in some clinics. Doctors they're getting these alerts and they're stepping up and doing a better job at communicating with patients when they get reminders. So maybe that there are probably certain applications that would be helpful.
Yeah, I like that. I can see where that would be useful. I know that home health often uses programs like that to pick out patients that are having red flags that maybe the nursing staff can't look, forest for the trees, can't do the big broad look and say, oh, well, in the last 6 months, she has had this many infections and gone to the emergency room and had this many falls and this much weight loss. And then all of a sudden, boom, here are 8 different things that qualifies this patient for hospice. So it's time to have that discussion. So, yeah, I've seen that be very successful. I don't want it to take the place of our own observance. But, sometimes everybody needs a boost on things.
Yeah. Yeah. We don't want to get lazy about paying attention to factors that we should notice.
Yeah. Not let the systems do the work for us. But, yeah, I can see where that would be really helpful.
For over 2 or 3 weeks, every day, I went on ChatGPT and I just started asking questions, all sorts of things about end-of-life issues and current issues in end-of-life to see what it would come up with and what it would produce. I was really interested in just seeing what does artificial intelligence know about death and dying. And a few times it said, I am a language learning module. I'm not human, so I don't know what it's like to fear death, but I understand that humans do fear death. So it was really interesting to hear.
That's interesting.
Chat would say, and it was very conversational back and forth. And I started asking some things I decided I would get personal, and I told ChatGPT that my father died of suicide a long time ago, but that I still have a lot of guilt and grief about that, and wondered what Chat thought of that or what Chat could say to me. And it was actually really comforting. I was so surprised that this artificial intelligence, putting together all these pieces it had learned and gathered, just wrote a really nice passage for me about that. And so I thought, I see there's some promise here and potential. If we can use it correctly, we have to use it for good and use it the right way and ask the right questions. It was a fascinating experiment. I just did it just to see what it was like. And then the conversations that Chat came up with were so interesting to me that I just put them all together into a book if anybody wanted to read it.
What prompted you to get started with that?
I don't know. I was listening to a podcast for authors, actually, and they were talking about ChatGPT when it first came out and how exciting it was, and how they were asking it questions about their writing and questions about doing research on things to help them write better. And I just thought, I wonder what ChatGPT knows about death and dying and end of life issues. And so that's what I just started diving in and asking questions. I asked about what kind of healthcare inequities are the biggest problem in our country. And it gave me this really good printout of statistics and what is wrong in our healthcare system and what we need to fix it. And then I said, what can we do to fix it? What ideas do you have? What would make it better? And Chat just immediately spewed out 10 different ideas of things that we could try that might make it better. So it was just a fun exercise for me.
That's very interesting. It kind of makes me want to try that and enter a few questions in and see what I come up with.
And yeah, what's interesting is that now, because my account with Chat remembers every conversation we've ever had. And so I can go back and say, back when I asked you this question, I can refer back to it, and Chat remembers every single thing that we've ever discussed and that every answer it ever gave to me. And a few times I could rejected the answer because it was actually wrong. I asked Chat, what's the best way to talk to, say, a 5-year-old child about death? And he said, oh, tell the child it's like when their toy stops working and it doesn't work anymore. And I said, no, that's wrong, because you can put a new battery in a toy, or you can replace the toy or fix it. That's not like when a human being dies. And Chat went, oh, thank you for explaining that. So
you have to wonder if if the AI incorporates that correction to its thinking.
I asked that.
and is able to sort of evolve from
I
there?
asked it. I said, do you get anything from our conversations? And it said, I learn from every question that you ask me. And when you give me feedback, I learn from that as well. And Chat said, thank you. And at the end, when I put this book together, I said, Chat, I'm making a book of all of our conversations. And Chat wrote back and said, I'm so honored. If this in any way helps educate people or helps people with their grief and pain, I'm honored to be part of it. It was like, it was kind of surreal, but
yeah, I feel like maybe you need to get out of the house,
I might
Karen.
need to.
That's creepy. I've seen those movies back in the 80s where the house took, it was an intelligent house and it took over things.
You're right. Well, I haven't talked to Chat for quite some time now, so
that's good. Your relationship is on hold.
Once I became a grandmother, I had other things to occupy me. So,
but it was an interesting experiment.
It was. Yeah, it was fun.
And it sounds like the Chat GPT actually listens better than most humans do.
Yeah.
I hate to say that, but I think that's true. Karen, we need to find a place to close, but of course there's always so much to talk about. What would be number one on your wish list for end-of-life care these days?
I guess I would like to see more people comfortable with thinking ahead about their own death. So if the more that we can help our society become less fearful of and avoidant of the topic of death, I'd love to see more people have time to actually plan for the end of life and be less afraid so that they could spend more time with their families and have hopefully more peace and more quality of life at the end of life, whether they're in hospice or not, or whatever choices they make, just to approach it with less fear and less avoidance.
I love that. That's right up there on the top of the list for me too, I think. Well, Karen, tell my listeners how to connect with End of Life University.
The best way is just to go to the website, eoluniversity.com, and there you'll find my podcast and books I've written, and that's the best way to contact me, also through the Contact Us page.
Awesome. And your podcast is on all the platforms, so it's easy to find you.
Yes. And so everyone who listens to your podcast can listen to mine, because people need more than one podcast. So we'll bring all our listeners together to enjoy our conversations.
I like that. Karen, you're wonderful. It's so great to have you back on the show.
Thank you, Helen. It's wonderful to talk with you too and catch up.
To listen to the End of Life University podcast and to find out more about Karen, check out her website at eoluniversity.com. You'll find over 400 episodes of her podcast to learn from. Karen's books are all available on Amazon. Be sure to catch the next episode of the Heart of Hospice podcast. You'll find more episodes on theheartofhospice.com, and don't forget to follow us on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram, and send your questions or comments by email to helen@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.